This is a really serious problem that we have to take seriously. I mean, people always say, well, the flu, the flu does this, the flu does that. The flu has a mortality of 0.1%. Sure. This has a mortality of 10 times that.
And while we deal with the growing emergency here at home, for many, the crisis is already in full swing. The most active hotspot right now is Italy. Nearly 200 people there have died in just the last 24 hours. Airports have been empty for several days, and now all stores except for pharmacies and food markets will be closed. Take a look at this. St. Peter's Square at the Vatican empty as the country with the highest death rate grapples with getting the spread under control. All this as a doctor on the front lines is issuing an alarming warning for his counterparts in America. ABC's Maggie Rulli is tracking the latest from London, where a health official there has announced they have COVID-19.
On this Wednesday night, the coronavirus officially reaches pandemic proportions. What it means and what it calls for.
This is a call to action and a call not to give up.
As more countries, including Canada, make plans to act.
We will make sure you have everything you need.
The first case of novel coronavirus was reported in Wuhan, China in December 2019. Early cases were believed to be linked to a live animal market in Wuhan and have since been spreading from person to person. Shortly after, cases of the virus began to appear outside of China, and on January 20th, 2020, the first case of novel coronavirus was reported in the United States. On January 30th, the World Health Organization declared the outbreak a public health emergency of international concern.
More cases should be expected in other parts of China and possibly other countries.
Coronaviruses are a large family of viruses, named for their shape, protruding spikes that look like a crown or a corona. SARS and MERS are part of the coronavirus family, as well as viruses that cause the common cold. The 2019 novel coronavirus was officially named COVID-19 on February 11th by the World Health Organization. Suspected community spread was first reported in the United States on February 26th, with no known links to people who've traveled to Wuhan, China. WHO said on February 27th that COVID-19 has pandemic potential.
This virus does not respect borders.
COVID-19 can cause flu-like symptoms that range from mild to severe, including cough, fever, and shortness of breath. Since the infection can include symptoms similar to pneumonia, influenza, and the common cold, only a diagnostic test can confirm whether or not an individual is positive for the virus. Thousands of people have died around the world. The first deaths in the United States occurred on February 26th. There are trials underway for treatments, but vaccines are still in the development phase and likely more than a year away. CDC officials say that Americans should prepare for major disruptions to their daily routines.
On this Wednesday night, the coronavirus officially reaches pandemic proportions. What it means and what it calls for.
This is a call to action and a call not to give up.
As more countries, including Canada, make plans to act.
We will make sure you have everything you need.
Are Canadian hospitals equipped to cope as the health minister spells out the worst-case scenario?
It's safe to assume that it could be between 30% and 70% of the population.
Social distancing, what you need to know about keeping your distance, slowing the spread, and flattening the curve of infections. And from producer to prisoner, the sentence for convicted rapist Harvey Weinstein.
Global National with Donna Friesen.
Good evening and thanks for joining us. The World Health Organization has now confirmed what many epidemiologists have been saying for weeks. The coronavirus is a pandemic. There are now more than 120,000 known cases in 114 countries. But it's not the word pandemic we should focus on, says the WHO. It's preparation, public health, and political leadership. Because all experts agree this is going to get worse.
The dangers of using a word if people use it as an excuse to give up, or if people see it as something that grows fear. It is not the time for countries to move towards mitigation only, unless and until they are not in a position to affect the course of the epidemic and try and stop this organism. The difficulty is that if you do not try and suppress this virus, it can overwhelm your health system.
In Canada, there are now more than 110 known cases of COVID-19, including a doctor in Ontario who treats cancer patients. And today, for the first time, the health minister gave an estimate of the number of people in this country who could become infected.
I would say that it's safe to assume that it could be between 30% of the population that acquire the COVID-19 and 70% of the population. This seems to be an acceptable range. I realize it's a large range, but that is actually what is our best guess.
And while we deal with the growing emergency here at home, for many, the crisis is already in full swing. The most active hotspot right now is Italy. Nearly 200 people there have died in just the last 24 hours. Airports have been empty for several days, and now all stores except for pharmacies and food markets will be closed. Take a look at this. St. Peter's Square at the Vatican empty as the country with the highest death rate grapples with getting the spread under control. All this as a doctor on the front lines is issuing an alarming warning for his counterparts in America. ABC's Maggie Rulli is tracking the latest from London, where a health official there has announced they have COVID-19.
Life in Italy has officially crawled to a halt. People are finally taking the country's lockdown seriously. It took a televised plea from Prime Minister Conte to protect Italy's older population.
Un'Italia zona protetta.
The country hit with an alarming rate of infection that's been difficult to contain. More than 2,300 new cases of COVID-19 in just the past 24 hours, bringing the number infected to more than 12,000 and claiming the lives of 827. Its healthcare system strained so badly, medical professionals fear resources may run out.
We need to shut down everything. Here, it was like a bomb. It exploded, and all of a sudden, you are overwhelmed by the patient.
Italy's government's heeding the calls. Everything but food markets and pharmacies are shutting down. Signs of a strained economy are palatable. ABC's Megan Williams is in Rome, where businesses were struggling to survive even before the total lockdown.
Just standing at my local pizzeria. Sandro, who's the pizzaiolo, the guy who makes the pizza, says that he has one more day probably to go like this. He's only had one client, and then he's going to close. That it's just not sustainable to keep his business open.
Food shopping is the last sense of normalcy people have here.
People are not hoarding the way they are in North America. People have smaller homes. They also have different habits. They go shopping every day, and for now, people are keeping those habits.
But fear is almost as contagious as the virus itself.
This is a really serious problem that we have to take seriously. I mean, people always say, well, the flu does this, the flu does that. The flu has a mortality of 0.1%. Sure. This has a mortality of 10 times that.
All right, estimates on the mortality rate for this new coronavirus have ranged anywhere from below 1% to 3.4%, slightly higher than the seasonal flu. And as the New York Times points out, quote, even a disease with a relatively low death rate, that's the mortality rate, can take a huge toll if enormous numbers of people catch it. Here with us, Dr. Amish Adalja. He's an expert in emergency medicine and infectious diseases. The doctor is also a senior scholar with the Center for Health Security at Johns Hopkins University Bloomberg School of Public Health. Dr. Adalja, thank you for being with us. This is what people are trying to figure out. Even the mortality rate's obviously greater than the flu, but when we think about these rates, we don't really understand how we get to the numbers that we're getting in terms of the infection of this. This coronavirus, COVID-19, is more infectious than the flu.
Definitely. It definitely seems to be spreading in a pattern that's similar to the flu, but it may be more infectious than the flu. And it's going to attack more people than the flu because we have no population immunity to this. So with the flu, there are antibodies that people develop from the vaccine, from prior infections. But this is a novel coronavirus, and it will attack a large amount of the population. Maybe 50% or more will get sick with this because it's totally new.
You and I were talking in the break about viral load. Talk to me about this. There may be carriers have a lot of the virus, and that is what perhaps makes them so infectious?
Yeah, so when you think about how infectious you are to other people, one of the key factors is how much virus you shed. And what we're seeing with this coronavirus in some of the studies is that it has a much higher viral load in your nasal secretions, in your runny noses and your sneezes than, for example, SARS was. And SARS was something that was pretty easily containable once people figured it out. But this is behaving more like the common cold-causing coronaviruses, and that's why we're seeing this accelerated spread all over the world.
What, in your opinion, is the way to fight this? obviously we're getting word out there for people to wash their hands and try and, quarantine themselves, seek aid from doctors, use telehealth if they can. But what, from an infectious disease perspective, is the policy prescriptive to putting a halt to the spread of this?
The best thing is to identify those cases and then isolate those cases so they don't spread it to other people. This is similar to what happened in South Korea, where they actually have a low death rate, around 0.6%. That's the best way to do that. If you allow people to be out there mingling with this, you're going to spread it, and it's going to get into people that are high risk, and then you're going to have higher mortality rates. This is something that's going to be hard to contain. It's not containable through travel bans or airport screening or quarantines. This is something where we really have to find the cases, isolate them.
Right. And we have a strange travel ban coming into effect. It's for non-Americans traveling from Europe. I wouldn't have guessed that the virus would make the distinction all that well.
No, this virus will infect you no matter what country you come from, and we've seen that. There's dozens and dozens of countries now.
The World Health Organization has officially declared that COVID-19, the disease caused by the new coronavirus, is a pandemic.
WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
Okay, what does the word pandemic actually mean? Well, let's start with the basics. A disease is endemic if it's common to a certain area. So, according to the CDC, the amount of a particular disease that's usually present in a community, that's referred to as the endemic level. When that level spikes up, you get an epidemic, an outbreak across a region, a country, or maybe even multiple countries. The Ebola outbreak in West Africa in 2013, that was an epidemic. But a pandemic, that's when an epidemic goes global. It's a whole new disease that we don't really have immunity to. It's crossing borders and continents, it's spreading quickly from person to person and infecting a large number of people. And in many cases, it has a high death toll.